Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya, and in today's class let us discuss about the renal epithelial cell cast and the mixed cellular cast in the urine. So आपको पता है ये कास्ट क्या है? ये बेसिकली एक मोल्ड है जो फॉर्म होता है अपना डिस्टल कन्वोल्यूटेड ट्यूब्यूल में एंड इन द डिस्टल कलेक्टिंग डक्ट. So they are classified as cellular as well as acellular. Acellular casts are your hyaline cast, granular cast, waxy cast, fatty cast, etc. And the cellular casts are the casts which contain cells. It could be RBCs, it could be WBCs, or it could be the renal epithelial cells. So these renal epithelial cell cast, they are formed when the epithelial cells which line the tubules of the kidney, they are shed off or they come together and they form a cast. And when does the epithelial cells of the tubules are shed or when they are thrown outside? Whenever there could be a acute tubular necrosis or when the tubules are damaged because of an heavy metal, etc. So these are the types of cast what you can see that time. So this is a case of an acute tubular necrosis. I have already told you that the urine sediment of such patients will show you a muddy brown granular cast. So this finding, if you see a muddy brown granular cast in the urine, they are highly suggestive that the patient is having acute tubular necrosis. Similarly, the epithelial cell cast, you can also see the free epithelial cells. This is a very important clue. Whenever you are looking at the cast, you should also see the background, whether there are free cells, what are the other findings in the urine to come to a conclusion. So here also you can see a free epithelial cells in the urinary sediment, and these renal tubular cells what you see, they are comparatively larger. When you see the white blood cells, they are also granular, so sometimes you might mistaken it for the WBC cast, but these cells are little larger than the WBC and they have a single large nucleus. They are not having the multinobated nucleus unlike the neutrophils in the WBC cast. So remember, when I have to differentiate this cast from a WBC cast, one is the size. The cell size of the epithelial cells are much larger than the WBC, and also the nuclei. Here there is only single nuclei, whereas in WBC you will usually find a multilobated nucleus of the neutrophil. So here you can see the epithelial cell cast. These are the epithelial cells. These are large cells, single nuclei, and they are looking granular. So these are the renal tubular epithelial cells. Here you can see the lipid droplets. This is the WBC here. So this renal tubular epithelial cells, I have told you, they are cast, so they will be there on the matrix of a, or the matrix which is formed from a protein. So I have told you, whenever there is a tubular destruction, that could be because of a heavy metal, or there could be because of a necrosis, or there could be because of a viral infection, or that could be because of an allograft rejection, you will get such kind of a cast. Sometimes in severe pyelonephritis also the renal tubular epithelium can be shed. So that time also you can find such casts, and that time you will also find the WBC casts. Since these casts are formed in the distal convoluted tubules, cells which are visible on the cast matrix are smaller and round and oval cells. Sometimes though we have told you the difference between the WBC cast and the renal tubular epithelial cell cast, it might be difficult to differentiate them both, especially if the degeneration has occurred. So in such cases, a staining and a phase contrast microscopies can be helpful to enhance the nuclear details or identification. So here you can see a slide wherein these are the renal tubular epithelial cells. They are bile stained, so in case of a hepatitis patient. So epithelial cell cast, what do they represent? They represent a advanced tubular destruction which will produce urinary stasis and also disruption of the tubular lining. So this disrupted tubular lining is shed and they appear in the form of a cast. there is something called as a mixed cellular cast. So what are these mixed cellular casts? These are nothing but the casts which contain multiple cell types. So they might contain RBC, they might contain WBC, they might contain the renal tubular epithelial cells also. So you can see that this RBCs and WBC casts are seen in glomerulonephritis, because in glomerulonephritis there is inflammation, there is bleeding. So you will find the WBCs, you will find the WBC cast. Because there is bleeding, you will see RBCs, also the RBC cast. While the WBC and renal tubular epithelial cells mostly you can see in pyelonephritis, because I've told you in pyelonephritis what happens, there is inflammation. So there can be WBCs, free WBCs, WBC cast, and because of the severe inflammation the lining can be disrupted, and that can come in the form of the renal tubular epithelial cell cast. So these are called as the mixed cellular cast. So here you can see these are the RBCs here, these are the WBCs which you can see here, and this is the squamous epithelial cells. So whenever there is RBC, remember there is a glomerulonephritis, or there is bleeding into the glomerulus, whereas the WBC cast, which will suggest you that there is some inflammatory process which is going on, that could be affecting the glomerulus or that could be affecting the interstitium. And sometimes the cast can be seen which contain both the RBCs also as well as the WBCs also, as you can see here, and such casts are called as the mixed cellular casts. So here this is a large picture where you can see these are the WBCs, what you can see here, these are the RBCs which you can see, this is a squamous epithelial cell. So that is all about the renal tubular epithelial cell cast and also the mixed cellular cast. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.